Hello everyone, welcome to my channel. This video is about port-wine stain or capillary malformation. Port-wine stain are also called capillary malformation. These are always present at birth. These vascular malformation consist of mature dilated dermal capillaries. Common locations include head and neck region, but they may be present anywhere on the body. The lesions are macular, sharply circumscribed, pink to purple, and tremendously varied in size. Most lesions are unilateral. The mucous membrane can be involved. As a child matures into adulthood, the capillary malformation may become darker in color and pebbly in consistency. It may occasionally develop elevated areas that bleed spontaneously. Now, port-wine stain are true capillary malformation and they should be distinguished from nevus simplex, which in contrast is a relatively transient lesion. Nevus simplex are a type of capillary malformation that occur as faint pink patches with feathery borders. These usually occur on eyelids, on the forehead between the eyebrows, or around the sides of the nose in the newborns. These nevus simplex are commonly called stork bites or angel kisses. Now, these faint in the first few years of life. So do not be alarmed if the birthmark gets darker when your baby becomes more emotional or active, because this is normal. Most nevus simplex are totally harmless and do not need any treatment. When port-wine stain or capillary malformation is lateral and localized to the forehead and upper eyelid, the diagnosis of Sturge-Weber syndrome must be considered. It is a rare congenital neurological and skin disorder, and it is not hereditary. Recently, researchers have found that the underlying cause of the Sturge-Weber syndrome is a somatic mosaic mutation in the GNAQ gene. Typical features of Sturge-Weber syndrome include glaucoma, leptomeningeal venous angioma, seizures, hemiparesis contralateral to the facial lesion, and intracranial calcification. Now, early screening for the glaucoma is important to prevent additional damage to the eye. Capillary malformation or port-wine stain can occur as a component of Klippel-Trenaunay syndrome. Klippel-Trenaunay syndrome is a rare congenital malformation involving the blood and the lymph vessels and abnormal growth of the soft and the bone tissue. Typical symptoms include hemangiomas and the varicose veins. Now, hemangiomas are abnormal benign growth on the skin consisting of masses of blood vessels. Treatment of Klippel-Trenaunay syndrome include compression therapy. In this, bandages or elastic garments are wrapped around the affected limbs to help prevent swelling, problems with the varicose veins, and the skin ulcers. Capillary malformation or port-wine stain can occur with moderate frequency in MCAP syndrome. Megalencephaly-Capillary malformation syndrome is a complex disorder that involves many organ systems including skin, blood vessels, connective tissue, and brain. It usually manifests at birth. Most affected individuals have a disproportionately large head and vascular malformation, including capillary malformation on the skin of the midline face, trunk, and the limbs. These capillary malformations often show a lacy or reticulated pattern, resembling a net or web, and are sometimes termed cutis marmorata. Most children with MCAP syndrome have an enlarged head, that is Megalencephaly, and other findings polymicrogyria on the brain MRI scan with associated neurological problems. COBB syndrome. It is an exceedingly rare clinical condition which is defined by the presence of port-wine stain and angioma in the spinal canal at the same metamere. The cause of the COBB syndrome is not completely understood. It is believed that somatic mutation in the neural crest or the mesoderm are responsible for its development fairly early in the development of the embryo. A case of 14-year-old boy was reported who presented with sudden onset of paraplegia, and physical examination showed a port-wine stain over the buttocks and the thigh. CLOVES syndrome. It is a recently described rare disorder which is characterized by tissue overgrowth and complex vascular anomalies. Now, CLOVES stand for congenital lipomatous fatty overgrowth on the torso or the trunk, usually on the back, flank, or the abdomen. V stand for vascular malformation, most often a port-wine stain birthmark, lymphatic malformation, arteriovenous malformation, enlarged vein, or a combination of these. E stand for epidermal nevi, which are raised wart-like bumps. And S stands for scoliosis, skeletal or spinal anomalies. PROTEUS syndrome. It is a rare condition characterized by overgrowth of the bone, skin, and other tissues. Organ and tissues affected by the disease grow out of proportion to the rest of the body. The overgrowth is usually asymmetric, which means it affects the right and the left side of the body differently. Symptoms of PROTEUS syndrome include raised, rough skin lesion that may have bumpy, grooved appearance, a curved spine which is called scoliosis, fatty overgrowth, often on the stomach, arms, and legs, non-cancerous tumor, often found on the ovaries and membranes that cover the brain and the spinal cord. BECKWITH-WIEDEMANN syndrome. It is a genetic disorder and it usually results from abnormal regulation of the genes in particular region of chromosome 11. People normally inherit one copy of this chromosome from each parent. Now, the most common feature of BECKWITH-WIEDEMANN syndrome include macrosomia, that is large body size, macroglossia, large tongue, abdominal wall defects, and increased risk for the childhood tumors, kidney abnormalities, hypoglycemia, low blood sugar in the newborn period, and unusual ear creases or pits. Now, the severity of this disorder varies widely in children and it is usually recognized at birth. However, few children have all the associated characteristics. WYBURN syndrome, also called Bonnet-Tacon-Blanc syndrome or reticuloencephalofascial angiomatosis. It is one of the rarer neurocutaneous syndrome. It is non-hereditary in nature and it involves an arteriovenous malformation that variably affects the retina, optic nerve, orbit, optic chiasma, and the tract, facial angiomas, and similar malformation of the midbrain. But not all of these sites are necessarily involved in each case. In the absence of associated anomalies, morbidity from this lesion may include a poor self-image, hypertrophy of the underlying structures, and traumatic bleeding. Treatment of capillary malformation or port-wine stain. The most effective treatment is pulsed dye laser. This therapy is targeted to the hemoglobin within the lesion and it avoids thermal injury to the surrounding normal tissue. After such treatment, the texture and the pigmentation of the skin are generally normal and there is no scarring. Therapy can begin in infancy because the surface area of the involvement is smaller. There may be advantages to treating within the first year of life. Although this approach is quite effective, retargeting of the stain may occur over time. So, ongoing treatments are required. Masking cosmetics may also be used as a treatment of port-wine stain. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.